Hello, welcome to my channel. Subscribe or like if you like. Today we are going to talk about Trazodone medicine. We will answer questions such as, what is Trazodone, what is Trazodone for, and we will also explain its mechanism of action, its side effects, its dosage, its uses, its contraindications, its warnings, pregnancy and indications. The commercial names of Trazodone are, Deprax, Sideril, Desyrel Dividose, Oleptro, and Trazodone D. Mechanism of action of Trazodone. Antidepressant belonging to the SARI group, it is a serotonin reuptake inhibitor and a 5-HT2 receptor antagonist. Therapeutic indications of Trazodone. Major depressive episodes. Mixed states of depression and anxiety, with or without secondary insomnia. Dosage of Trazodone. Oral. Adults, 100 to 150 mg/day, in divided doses, after meals, or in single dose, at bedtime. Increased by 50 mg/day every 3 or 4 days, preferably at bedtime, until the maximum effective therapeutic dose is reached. Maximum dose, 400 mg/day. In hospitalized patients it can be increased up to 600 mg/day, in divided doses. Elderly or debilitated, 50 to 100 mg/day, in divided doses, or in single dose at bedtime. It can be increased gradually under supervision as described in adults according to tolerance and efficacy. Contraindications of Trazodone. Hypersensitivity. Intoxication by alcohol or with hypnotics. Acute myocardial infarction. Warnings and precautions with Trazodone. Children under 18 years, increased risk of suicidal behavior and insufficient data on safety. Close monitoring during treatment, especially in the early stages and changes in dose, risk of suicide and suicidal thoughts. Schizophrenia or other psychotic disorders, risk of worsening psychotic symptoms. Known cardiovascular disorders, including prolongation of the QT interval. Concomitant with substances that prolong QT intervals such as, class II and III antiarrhythmics, antipsychotics, phenothiazine derivatives, pimozide, haloperidol, tricyclic antidepressants, certain antimicrobials, sparfloxacin, moxifloxacin, erythromycin-4, pentamidine, malaria treatment, particularly halofantrine, estemizole, misolastine. Periodic control in heart failure, angina, conduction of disorders or AV blocks of different degrees, arrhythmias, recent myocardial infarction, of congenital long QT or bradycardia, epilepsy, avoidance of sudden increases or decreases in the dose, liver failure or kidney failure, hyperthyroidism, prostate hypertrophy, acute closed-angle glaucoma, increased intraocular pressure. Elderly people more sensitive to anticholinergic effects. In prolonged treatments reduce the dose gradually to avoid withdrawal syndrome. Suppress treatment if jaundice appears. Risk of serotoninergic syndrome or neuroleptic malignant syndrome. Liver failure and Trazodone. Caution in liver failure, specifically in severe liver failure. Consider periodic monitoring of liver function. Renal failure and Trazodone. Caution in severe renal failure. Interactions with Trazodone. Increases the sedative effect of alcohol, antipsychotics, hypnotics, sedatives, anxiolytics and antihistamines. Effect increased by erythromycin, ketoconazole, itraconazole, ritonavir, indinavir and mifazodone. Effect decreased by carbamazepine. Increases the effect of muscle relaxants, volatile anesthetics. Risk of serotonin syndrome with tricyclic antidepressants. Increased risk of toxicity with hypericum perforatum. Pregnancy and Trazodone. Data regarding the use of Trazodone in pregnant women are limited. Animal studies indicate no direct or indirect harmful effects with respect to pregnancy, embryonic or fetal development, delivery, or postnatal development at therapeutic doses. As a precautionary measure, it is preferable to avoid the use of Trazodone during pregnancy. Prescription to pregnant women should be made with caution. When Trazodone is used until delivery, newborns should be monitored for the occurrence of withdrawal syndromes. Epidemiologic data suggest that the use of SSRIs in pregnancy, especially in the late stages of pregnancy, may increase the risk of persistent pulmonary hypertension in the newborn, PPHN. The risk observed was approximately 5 cases per 1,000 pregnancies. In the general population, there are 1 or 2 cases of PNH per 1,000 births. Although there are no studies that have studied the association of PNH with Trazodone treatment, this potential risk cannot be ruled out. Breastfeeding and Trazodone. It is not known if Trazodone and its metabolites are excreted by human milk. The risk to the infant should not be excluded. The decision to continue or stop breastfeeding or to continue or stop Trazodone therapy should be made taking into account the benefit of breastfeeding to the child and the benefit of Trazodone treatment to the mother. Effects on the ability to drive of Trazodone. May cause sedation, dizziness. Therefore, patients should be advised that if they experience sedation or dizziness, they should avoid potentially dangerous tasks, such as driving or using machines. Trazodone side effects or adverse reactions. Unknown frequency, blood dyscrasias. Allergic reactions. Syndrome of inadequate secretion of antidiuretic hormone. Hyponatremia, weight loss, anorexia, increased appetite. Suicidal behaviors or suicidal ideation, confusion, insomnia, disorientation, mania, anxiety, nervousness, agitation, disillusionment, aggressive reaction, hallucinations, nightmares, decreased libido, withdrawal syndrome. Serotonergic syndrome, convulsion, neuroleptic malignant syndrome, dizziness, vertigo, headache, drowsiness, agitation, decreased mental acuity, tremor, blurred vision, memory alteration, myoclonus, expressive aphasia, paresthesia, dystonia, altered taste. Cardiac arrhythmias, bradycardia, tachycardia, ECG abnormalities. Orthostatic hypotension, hypertension, syncope. Nasal congestion, dyspnea. Nausea, vomiting, dry mouth, constipation, diarrhea, dyspepsia, stomach pain, gastroenteritis, increased salivation, ileus paralysis. Liver function disorders, intrahepatic cholestasis. Skin rash, itching, hyperhidrosis. Pain in extremities, back pain, myalgia, arthralgia. Urination disorder. Priapism. Weakness, edema, flu-like symptoms, fatigue, chest pain, fever. Bibliography. The information provided is true, safe and rigorous. It has been written by a doctor taking into account the clinical information of all the medications authorized and marketed in Spain, Europe and the United States. For more detailed information on each drug, the corresponding technical file authorized by the EMA or the FDA must be consulted.